Hi, hello again. It's Shireen, and I'm coming to you again on part two of health maintenance. Okay, and having a primary care physician established is so important. For instance, if you're hospitalized, that primary care physician can reach out or can be reached by your hospitalist or your physician in the hospital and can get some history about you, right? They can divulge your medical history, discuss whatever has been going on with you in the community, right? To get a better idea on how to treat you, on how you've been treated in the community, and what your health history has been over time. Okay, and this is very valuable information for your hospitalist or your physician in the hospital to have because it helps them get an idea of what's already been done for you in the community and what they can go forth and do to best serve you. Okay, for instance, if you have medical history such as diabetes and hypertension, right? They can have a trend, right? They can trend what's been going on. They have labs, what is been working, what medications have been working, what testings have you done, and what are the outcomes of what you've been doing in the community. Okay. Also, having a primary care physician is important. For example, as a case manager, establishing a primary care is important when we're discharging patients into the community, right? If they need visiting care services, visiting nursing services, some of the visiting nursing services require that you have a primary care in the community, right? Because they need someone to contact for orders while you're in the community, right? And this can cause a delay in your transitional care from the hospital back home, okay? Because you don't have a physician or a primary care provider established within the community. Okay, the necessity of having healthcare and wellness care or preventative medicine is uber important, right? I'd like for you all to think about that, right? Think about wellness care, preventative care as healthcare and a part of your healthcare planning, right? As part of the proactive approach to advanced care planning. The purpose is to establish all of these things that are needed as part of your decision making, your healthcare planning, and your health and wellness plan. It is amazing, right? As being when I was at the bedside as a critical care nurse, right? We'd have patients that would come in and say they don't have any health history. And that's not necessarily true, right? The truth of the matter is, these individuals have been ill or have had underlying illnesses over time that didn't necessarily manifest outwardly, that could have been caught earlier through wellness checks, through routine blood work, through urinalysis, right? Diseases that are very popular or very common among certain populations, right? African Americans or certain demographic groups, right? Such as hypertension and diabetes, right? These can all be seen or be found earlier because patients are having wellness checks, right? Diseases such as blood pressure, hypertension, right? This is so important, right? It's called a silent killer for a reason. Why? Because you don't realize that you have this until it has wreaked havoc on your body, right? If you end up in the hospital, you end up in the intensive care unit, right? In hypertensive crisis and affecting your kidneys ended up with a stroke, a heart attack, right? Also with diabetes, right? Just a routine blood work would show that maybe you've been pre-diabetic for some time and you could have made adjustments for that. Okay, so having great health maintenance and wellness check is also an essential part of healthcare planning and life care planning in order to have your best outcomes when it comes to your health. Okay, this is so important, and also this is Breast Cancer Awareness Month. Okay, so for all of you all that have not had your mammograms, if it's time for that, just don't neglect that. Go ahead and take care of that and be well. Okay, guys, take care.